Good evening, everybody. Call to order the June 22nd CMH full board meeting, and we will start with the pledge. Please rise. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Next, we will have Linda read the mission statement.
Sure. Our mission, Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence.
Thank you, Linda. Next, we will adoption of the agenda. I'll take a motion to adopt.
So moved.
Support.
Motion from Megan, support from Ryan. Questions, comments on the agenda? Hearing and seeing none. All in favor signify by saying aye.
Aye.
Aye. All opposed? The agenda is adopted. Next is hearing of the public. Anybody from the public wishing to speak? Anybody from the public? Dana, your boys don't want to speak? All right, we will close the first hearing of the public. There's another near the end of the meeting. And we'll move on to item 5A, approval of the minutes of the CMH full board meeting dated May 25th, 2022. Take a motion to approve.
So moved.
Support.
Motion from Ryan, support from Lori. Questions on the minutes? Seeing and hearing none, all in favor signify by saying aye.
Aye.
Aye. All opposed? Minutes are approved. Approval of standing committee meeting minutes. We did not have program and budget this month, so we do not need to approve those. And we will move on to item 7A, request to approve an RFP for psychiatric review services.
So moved.
Motion from Megan,
Support.
support from Dana, and I'll turn it over to Dave.
Yep, I can take this one. So we are asking for an RFP for the psychiatric review services as it stands down here. This is for our NCQA accreditation. As we continue along this process, we've learned that one of the must-pass elements is that any denial has to go through a psychiatrist or a master's level, a fully licensed psychologist or psychiatrist. With the volume that we have, we don't have the resources to meet that need. So we would like a service like this to come over and be able to review those denials and actually deny something, and then that would lead towards our accreditation.
Thanks, Adam. Sorry about that. That was Dave. Anybody with questions on this item for Adam? All right, hearing and seeing none, all in favor signify by saying aye. Aye. All opposed? Motion passes. Next is going to be item 7B, a request to approve an RFP to contract with an agency to train direct services professionals. Take a motion to approve.
Motion to approve. Support.
Motion from Lori, support from Selena.
You or me?
Adam?
Yep, it's Adam's show tonight. I can take this one again. So this is actually to improve the resources that we have for meeting the need for direct service provider training. Currently, it's all done through our training center, and with some of the challenges in hiring with nurses in particular, we're having some challenges in always being able to meet this. So we just want to expand our resources a little bit through releasing this RFP.
Thanks, Adam. Questions, comments from board members? All right, hearing and seeing none, all in favor signify by saying aye.
Aye.
Aye. All opposed? Motion passes. Next, we'll move on to 7C, request to approve the statement of work Medicaid verification audit with Jefferson Wells, and this was approved by legal. Take a motion to approve.
So moved. Support.
Motion from Megan, support from Antoinette. Thank you. Dave or Adam?
I was going to say, Adam's on a roll.
That's all I got tonight.
I think I'm losing my voice. We've been using this vendor for years. They changed their name previously. Recently. They used to be Experis. So we are looking at, it's a requirement that we have Medicaid claims verification process. So we contract with them for that. We are looking at being more specific. We cannot audit ourselves, but we can, at some future point, maybe start doing some of our external providers. But for right now, we still need this resource. So it's something we've been doing every year for quite some time, as long as I've been here.
Thanks,
We
Dave.
just put it out for bid again, and they were the
Questions, comments for Dave? Okay, hearing and seeing none. All in favor signify by saying aye. Aye. All opposed? Motion passes. Next is 7D, a request to approve residential lease A, which has been approved by legal. Take a motion to approve.
So moved.
Motion. Motion from Linda, support from Lori. TJ, did you have anything out of the ordinary for this one? It didn't look like it.
Yes, please say or B if you have any questions.
Board members, any questions on A? I looked through all of them. It looks like everything was taken care of that needed to be taken care of and signed off on for both of them, so that's good. All right, seeing none for A, all in favor signify by saying aye. Aye. All opposed? Motion passes. Next is 7E, request to approve residential lease B, which has been approved by legal. Take a motion to approve.
So moved.
Support.
Motion from Ryan, support from Megan. Questions, comments on B? Easy night for TJ. All right, all in favor signify by saying aye. Aye. All opposed? Motion passes. Thanks, TJ. Next, we'll move on to 7F, request to approve CBH 2022 Intensive Crisis Stabilization Services Expansion, Final Amendment, and Veterans Systems Navigator. It is not noted on your agenda because legal just approved it today. So it has been looked over by Corp Counsel, and they signed off on it. I'll take a motion to approve.
So moved. Support.
Motion from Dana, support from Lori. Dave, go ahead.
The details in your packet. This is one of the amendments that comes through the e-grams system from the state of Michigan. They have been asking for signature on this, and I've let them know about our process that has to go through. It's a budget change, and I'm trying to, can't quite rotate that around.
I can rotate it for you.
Oh, there it is. Thank you, sir. Yeah, intensive crisis stabilization services for 150 through, these are grant services, clubhouse engagement, Liberties is in here. The pass are for the OBRA screenings. But I think on this one, they modified the budgets for the Veterans System Navigator and the intensive crisis stabilization. Those were the two areas indicated in this amendment.
Questions or comments for Dave?
I have one quick question.
Dana, go
I
ahead.
don't know how to work the buttons. Who is our veteran navigator right now?
Diana Lasky.
Okay. That's what I thought somebody was asking me. That was it.
We, now you reminded me too, we can ask Diana to do a presentation to the board.
That would be great.
I've met with her individually. We went to the Tri-County Veterans event. I met the statewide Vet Navigator Coordinator, who just sang her praises. We're doing some really good things with our Vet Navigator services. I learned a lot at the Tri-County
We
event.
have a meeting with her in July.
Yeah.
First meeting.
But yeah, I'll ask her to do an update status to the board.
That would be great. Thanks, Dave.
Thanks, Dana. Anyone else? Okay, hearing and seeing none. You only get one for free. All in favor signify by saying aye. Aye. All opposed? Motion passes. Next, we'll move on to receive and file. We have no items there. Resolutions, no items there either. And we'll move on to voucher listings. I'll take a motion to pay the bills.
So moved. Support.
think that was Selena and Antoinette. Questions, comments on the bills? Seeing and hearing none, all in favor signify by saying aye. Aye. All opposed? Bills are paid. And now we will move on to the CFO update. Richard is not here, but Ken is. Ken, welcome. Just push the button at the base of the mic so we can hear you.
Hello, everyone. Thanks. I heard you were all sick of hearing from Richard, so I'll come and deliver the report this month. Same financial packet as usual. Page 2. No surprises there. I don't think revenue and eligibles continue to be high until the public health emergency ends, which is still somewhat of a question mark, at least through the end of this fiscal year, probably into a good portion of next fiscal year. We'll see that once it lapses, the state will start, people will start dropping off Medicaid, want to get people enrolled, spend down will be back, that kind of thing. Page 4, we can see here that capitation revenue remains fairly consistent with prior year. I don't think there's anything too noteworthy on here or surprising as far as that goes. Page 5 kind of gives a summary of our major fund sources, Medicaid, Healthy Michigan General Fund. We are working on gathering up some CCBHC data as well for that reporting and working with the state on how that is actually going to be reflected in our system. So next month we should have a good update for that as part of this page. You can see here lapse numbers, basically the surplus in each one of these categories continue to be quite large, trying to do everything we can to use those dollars, make sure we're not giving anything back to the state that we don't have to. I know we sent out some communication about the provider retention bonuses and that work. We expect that to be pretty significant. We've received a ton of feedback and questions, so I think that was a good thing. So we'll keep working through those and get those paid as soon as we can. Page 6, again, nothing out of the ordinary here. Cash and liabilities maintain a high level because we haven't settled with the state for fiscal 20 or 21, which are very large dollar amounts. So we have that cash, but we also owe it mostly to the state. Page 7, income statement. I don't think there's anything on here that's terribly out of the ordinary either. As I said before, revenue continues to be high, and there's really no changes month over month that were significant. Budget to actual, page 8. Again, same thing. We don't have any outliers or things that I will highlight at this time. And page 9 is the substance abuse fund for that as well. Page 10, we always provide the top 10 providers for both mental health and substance use. Not much change here either. By this point in the year, claims have kind of, I guess I'll say, settled out, and this chart pretty much looks the same except for a couple that are at the bottom might switch off month to month, but that's about it. Happy to answer any questions, concerns, research what I can if I don't know.
Thanks, Ken. Any questions, comments? It's perfect.
Awesome.
Thank you, Ken. Appreciate it. All right, next we will move on to the CEO update with Dave.
Good evening, everybody. I was looking back through my calendar since it's been a while since we met. So since we've met last time, we did, a good group of us were able to attend the CMH Association's summer conference up in Traverse City. Antoinette, Linda, we missed you. And Selena and Mark were up there. I looked right at you. I looked right at you. You were pointing at somebody else, so I skipped you, sorry. And Lori Phillips joined us. Yeah, so we were very well represented. We also then had the Metro Region dinner, which was virtual. There has been a round of follow-up emails after that about some of the coordinated topics that we could collaborate on regionally. So there will be activity in those areas that I'll be able to report out on. The I guess the big news, I've shared it electronically, you've probably all seen it, is the Senate bill, Senate 14. So that was passed at the state level, $565 million spending bill. The bad part of it was tie-barred or contingent upon the passing of Senate Bills 597 and 598, which is Senator Shirkey's redesign plan that would eliminate the PIHPs, the CMHSPs, and go to give everything to the Medicaid health plans. They're called SIPs in his plan, but in order to be an SIP, you pretty much have to be a Medicaid health plan. That was originally everything was in there was connected to the passing of those bills. I did provide an update that subsequently the tie bar was limited to 6 areas. There was $15 million to Detroit Wayne. There was money for a jail diversion program. The local match dollars are what the CMHs contribute to the state in order to draw down additional Medicaid dollars. They're looking at eliminating that, which will put some more money back in the CMH pockets. And then there was 3 other areas that I didn't research exactly. Senator Mike McDonald continued to support us by voting no. I did reach out to his office and thank him for his continued support. I also reached out to Senator Wozniak's office, Scott Ray, in his office, and express our concerns about anything that would continue down this path with Senate Bills 597 and 598. Might be a good time to convene our Legislative and Policy Committee. As this Alan Bolter was saying, these items would probably go into the fall, or lame duck issues, so we could make some plans for things we might be able to do between now and then. I do, for the sake of my staff, this is not a done deal. The Senate Bills 597 and 598 were not passed. This was just one more step. There's a lot of things that can and will happen between now and then. I will keep everybody posted and updated, but now is not the time to panic or anything else. So yeah, we're well positioned, and we're focused on our internal activities and making all the improvements. And again, as Ken mentioned, the public health emergency will be coming to an end, so we are working very hard to get the systems in place to make sure that when the money is the revenue gets corrected back and people come off the Medicaid rolls, that we are very well positioned to manage that very well. So we are working very hard in a number of those areas to make sure that that is true. Happy to answer any questions. Oh, the spending plan that was, I promised the board an update. I am working on that. I'm waiting a couple more details. But we've been doing the provider stability. Ken has shared all of that detail with me. Just waiting on some of we did some, in the license settings, we made some funds available to them for some appliances, physical plan improvements. Once I get that, I'll get the board members all of that detail. That's my homework.
Anybody have any questions for Dave? Comments? Okay, thanks, Dave. Next, we will move on to other possible agenda items. A couple reminders. Program and budget. We are planning to have program and budget in July. It'll be the 13th here at 6 p.m. Recipient rights is planned for Thursday, July 21st at the administration building, and full board will be here July 27th at 6 p.m. Do any board members have anything they would like to discuss, bring up? Dana, go ahead.
What button do I hit if I want to talk?
The one in the middle.
Okay. You guys can hear me okay, right? So I just wanted to share this with you guys. I thought this was really cool. One of my friends that works at, turn this on?
Yeah. There you go.
Oh, cool. Okay. One of my friends that works at CMH sent this to me, and I thought you guys would like this. ACT is starting the summer on a green note. After all the planning and excitement, our garden is underway. Staff and consumers have been very excited about this project, and each is looking forward to eating fresh organic vegetables all this year. A big thank you to Stephanie Lang and John Brody, who made all this possible. We now have 3 raised gardens in full sun at the end of the atrium at the West Clinic. Staff and consumers have been sharing for months what they would like to grow, what they would like to eat, and learning new recipes while introducing fresh vegetables into their diets. We celebrated Planting Day with a party where staff and consumers attended and participated in mixing the soil and planting 16 kinds of vegetables and herbs, more than 100 plants. Consumers brought their boundless effort and did a great job farming. So that is at the end of the atrium at the West Clinic, and I just thought that was really neat. It sounded like everybody had a really good time doing that. So that's it. Thank you.
Thanks, Dana. Thank you for sharing that. Any other board members with anything? No? Okay. We will move on to the hearing of the public. Anybody from the public? You have 5 minutes. Hi, Sean.
Hello. Good evening. My name is Sean McGregor. I'm with CEO, just to give our monthly report. For Anchorville, they attended the movies. They also went bowling. They did Sloppy Joe's for the person served for a free Friday lunch. One of the persons served had a birthday party, and the parents provided a free lunch for everyone. And then also they hosted their own summer camp at Ira Park to do outdoor activities, music, and games. At our Clinton Township, Mount Clemens location, they got their garden planted, and it's well taken care of. Person served and staff also helped prepare some things for a Relay for Life event. At our Washington location, they had a traveling Father's Day gift fundraiser where they made over $140. They also had 6 new person served start with 3 tours. They also updated their courtyard, basketball net, and raised their garden boxes. The brush surrounding the property was cleared. They acquired new picnic tables and replaced the American flag outside as well. And then just lastly, due to the weather conditions this week so far, our summer camp was postponed and rescheduled for next week, Monday through Wednesday. However, tomorrow our annual summer picnic is still on, and that's at Metro Park at noon. And thank you. Have a good night, and happy 4th of July.
Thank you, Sean. Anyone else from the public wishing to speak? Anyone else? All right, seeing none, we'll close the hearing of the public. Take a motion to adjourn.
So moved.
Dana, Megan, all in favor? Aye. We are adjourned. Everybody have a good night. Thank you.